So let's welcome him straight away.
Okay.
Thank you, sir, for logging in. Very sweet of you to have come in much earlier than anybody else. A warm welcome to you. Can you hear me?
हाँ मैडम
So he's muted by his own team or from here? To mute. Okay. If he's here, he may as well say a few words if he can. No? Yeah. No, he's still muted here. We have our honorary treasurer, Mr. Mathur, also logged in here. A welcome, Mr. Mathur. Can you hear? A round of applause for the two gentlemen who arrived on time. I hope when the cameras are showing the people on stage and around, are not showing the empty chairs at the back. Please don't do that. Concentrate only the front half if you have to. Yeah. Oh, Urvashi, good morning. Nice to see you on stage, but can you switch on your camera, please? She can't hear. I think it's only her PS who must have logged in and she's not here. So should I really start now? Yes. Just 2 minutes more? Okay, 2 minutes more. Well, good morning, everybody. I, Renuka Prasad, the Honorary Secretary of the Indian Cancer Society, welcome you all here on this rather rainy day. The rain has made it a little more chillier than ever, but we Delhiites look forward to this carrying on as long as possible to avoid that dreary summer that sets in. So I take this opportunity here to welcome for the launch of our app for which we are all gathered here today, our key personalities. Actually, Mrs. Urvashi Prasad was to be with us, but I think that inclement weather has kept her away and she's with us on Zoom. So a warm welcome to you, Mrs. Prasad, for being with us this morning. We have here with us also our co-host, Mr. D.S. Negi, who is the CEO of the Rajiv Gandhi Cancer Institute and Research Center. And we have also Vinay Subramaniam from Roche, who is here today, acknowledging the wonderful work, the startup which they gave us to set this app rolling. And how can one not welcome our own chairperson, Mrs. Jyotsna Govil, that's the Indian Cancer Society Delhi branch's chairperson, for being here, for being the guiding spirit throughout with us during the making of this app, as is always in any endeavor that we undertake. I also welcome the distinguished guests who are logged in. Can I just see who all they are, please, so that I can name them? I just told you that we've had our chairman who's logged in here, Mr. Hari Mundra. There is also Mrs. Usha Thorat, the Honorary Secretary and the Managing Trustees, Dr. Anita Borj, Chairman of ICS, and Dr. Sudeep Gupta, Director, Tata Memorial Hospital, Mumbai. So you're all logged in, and anybody else also, any of the guests who have logged in, a very, very warm welcome to all of you on this auspicious day of the launch of our mobile app. So it's really a landmark day for all of us, and I'm honored to invite the dignitaries present here this morning for the lamp lighting to start today's deliberations. I also request Dr. Vandana Damankar, representative of ICS, headquarter Mumbai, to join in this. Mr. Subramaniam, please join in. Vandana, Jyotsna, Mr. Negi, and Madhav, since you are also representing the ICS Mumbai, please come in for the lamp lighting. Can we have the background score which has been prepared for this? Thank you. I now request Mrs. Jyotsna Govil, Chairperson, Indian Cancer Society, Delhi branch, to deliver her welcome address. She needs no introduction, as she is a well-known personality in her own right and has left an indelible stamp in the cancer scenario of Delhi amidst all other people who are in the field of dedicated service for people with cancer. So, ladies and gentlemen, Jyotsna Govil, a round of applause for her.
Thank you very much, Renu. Today is a very special day for all of us. And it seems hard to believe that 2 years of absolute... Can you stop talking over there, please? Thank you. 2 years of chasing after people, doing all kinds of acrobatics almost, have finally culminated in today's event. Thank you, Priya Parmar. Thank you to the team, Vaishali and Choti Priya. I'm so proud of you all. You know, my son is a songwriter. A few weeks ago, he made a song in which he said, the title of the song is Once in a While, but the storyline of it is, at least sometime, everyone needs to sit in peace and quiet and ponder over their lives. What would you like to remember? What would you like to dream of and go forward? Once in a while. So maybe at the end of this event, everyone will also go back and ponder once in a while of how we have grown. I'd like to remind you that Indian Cancer Society was set up in 1951, just 1 year after India became a republic. So if it is Amrit Kal for the country, it is also Amrit Kal for Indian Cancer Society. Perhaps you can give everyone in Indian Cancer Society a big round of applause. For the past few days, I've been talking about the history of Indian Cancer Society endlessly. So today I want to touch on some points which I have not spoken earlier. Every NGO has a set of values which was set by our founder, our senior members, and going on by each one of us. So I will remind you that it was Dr. Jassawala from Tata Memorial Hospital who set the ball rolling. He was a great doctor, a great oncologist, a great surgeon, but I want you to remember that he had the humility to admit that as he could not, or any doctor could not, control cancer on their own. They could, as he put it, cut, slash, and burn endlessly, but they would not reach the end because people were not coming to them early enough. So he asked that the Indian Cancer Society be set up, which provided awareness, which provided the facility of screening, and which provided support for all cancer patients. And that is precisely what we have done now for 74 years, 73 years. So my first lesson was in this quality of humility, of admitting that each one is not alone. We have to work as a group to achieve anything at all. For the past 4 days, I've been incessantly asked about statistics. How many people have cancer? How many people in the north as compared with the south? Are there more cases in the north as compared with the south? Well, frankly, that does not interest me. I think that what Dr. Jassawala's first lesson was to think of every single person as an individual who was suffering. And if that was so, then we had to do something about it. We had our vision statement, which said we would be a beacon of hope, but we also had some very strong statements that came to us over the years. First, that statistics are only people with the tears wiped away. People with tears wiped away. So those numbers in themselves have no meaning unless we remember the people behind them. We also moved forward into our various branches. And that same statement holds true for most of us. In Bangalore, my friend Kishore Rao set up the hospice, Karunashray. Karunashray, think of the name, where the dying could come there and die in dignity, free of pain, and cared for till the very end. In Mumbai, my friend Purna Kurkure set up a group for children, Ugam, and Vandana here is part of that very strong group. So if the dying are one end of the scale, these children are the other. They are our hope. They can be cured, they can be looked after, they will have full and fulfilling lives ahead of them. So we're addressing that. Our managing trustee, Mrs. Thorat, set up the Cancer Care Fund, which provides financial assistance to everyone suffering from cancer right across the country. I think, Vandana, there are about 16 hospitals, if I'm not 19 hospitals. And people are helped to the extent possible. I sit in on some of those deliberations, and I'm constantly amazed at how much detail the doctors go into, the due diligence committee goes into, the AI platform Navya goes into. Another huge feather in our cap. Let's come back to Delhi. How many of you realize that this hospital, the Rajiv Gandhi Cancer Institute, should have been called the Indian Cancer Society Hospital? It was our short-sightedness that we did not permit loans to be taken. So another society was set up. And this hospital was built. It started as a 50-bed hospital. It is today a 500-bed hospital. And Mr. Negi, even if I steal your thunder, I like to claim the first ownership of this wonderful place. I also like to think that the patient support system in India started in Delhi. Harmala Gupta, who is today the vice chairman of RGCI, was the one who brought the idea to us, who emphasized the need of support, of having support groups where patients and survivors shared their experience. Patients had to believe their doctors. They didn't necessarily believe everything they were told. But if they talked to another person who had walked that path, they believed them. That's why the name Sahyog, someone who walks the path with you. We have wonderful people who have carried Harmala's vision forward. So many survivors who are right here in this room. I'm very proud of you ladies. You really do a superb job. But one more thing that we do in Delhi is our emphasis on awareness. Unless you know what cancer is, unless you understand the nuances and understand that you can cure it if you go early enough to hospitals, we will continue down the path of patients arriving far too late for cure and only for care. So, our entire effort on awareness arises out of this belief that we need to be aware about cancer, and that is the only way forward. We have many schemes. Perhaps you know some of them. We have a platform on Swayam, which goes out to everybody. We have the faculty development program that takes information out to the universities of this country. And now we are going to come to this beautiful program, Rise Against Cancer. I won't take any more of your time. I think we make, as Vandana said, a pledge that we will all rise together against cancer. Thank you.
in addition to many, many more things than what you have just seen. For example, our Delhi branch has its own film, the Bengaluru branch has its own. There's another one in Kolkata, which is having its own launch today itself in Kolkata, and also in smaller places like Nagpur, Lucknow, and also Patna. So I thought I'll just make a quick mention of these, that don't think this is where the Indian Cancer Society work ends. No, it doesn't. It includes many, many more activities under its umbrella. So now I would like to request Rekha Gulabani, who has fortunately reached the venue on time now. So I will hand you over to Rekha Gulabani. She's a survivor volunteer with the ICS Delhi branch who inspires all of us with her repertoire of Sher Shairi as she conducts the proceedings for the day. So Rekha, over to you. Come, Rekha.
Good morning. Sorry.
I request everybody to please put their phones on silent. Thank you.
Sorry for the delay. So I would like to say, चंदन की खुशबू चौखट पर बिछाते हैं, पवित्र भाव से खुशी के दीप जलाते हैं, आपके आने से महफिल में चार चांद लग जाते हैं, जैसे तस्वीर में सारे रंग भर जाते. Hello everyone. On behalf of Indian Cancer Society, I, Chandrarekha Gulabani, welcome you all on this occasion, on this grand event of the launch of the Indian Cancer Society Reach Against Cancer mobile app, the first milestone on the way to eliminate cancer. So, you know, the slogan of Indian Cancer Society is conquest of cancer by choice and not by chance. इंडियन कैंसर सोसाइटी का ये कथन है कि कैंसर पर विजय इत्तेफाक नहीं, हमारा चयन है. सही जीवन शैली अपना लो, समय समय पर जांच करा लो, पहला लक्षण दिखते ही सही डॉक्टर, सही अस्पताल से सही इलाज करा लो, तो कम से कम कैंसर से मृत्यु तो ना पाओ. So statistics are the people with tears wiped away. On this World Cancer Day, close the care gap. First step towards winning over cancer is awareness. Today, the digital world has made things so simple to reach out to the whole community, and you know, this wonderful app is going to create that awareness, which is the first step towards eliminating cancer. Raho cancer se do kadam aage. Now, I have the honor and privilege to invite the CEO of the Rajiv Gandhi Cancer Hospital, and I think we should welcome him with a big round of applause, the CEO of Rajiv Gandhi Hospital. Thank you. Thank you, sir.
Good morning, everyone. At the very outset, I'd like to congratulate and thank Mrs. Govil, the chairperson of ICS, for always being in touch with the latest what's happening in the world in terms of cancer awareness and detection, and also the screening part of it. In fact, we have learned a lot. The reason being, as she said in the beginning, we owe our existence. That means the Rajiv Gandhi Cancer Institute, we owe our existence to the Indian Cancer Society. And I can assure you, the relationship is still symbiotic, and it will continue to do so. And why you know, like the Indian Cancer Society started this, the land was allotted to them, and why then Indraprastha Cancer Society came. And those days I was told Mr. Mehta used to have two hats. One was the Indian Cancer Society, the other was trying to, you know, set up a diagnostic center. So I think so we have a very common, I think, origin, I would say, in Delhi at least. So I can assure you that we'll maintain the same sort of relationship, because after all, the aim and objective are the same. We are on the same boat and trying to help people. And as far as cancer awareness is concerned, I think they have done a marvelous job in Delhi since its inception. I think again Mr. Mehta probably brought this to Delhi when he, I think, superannuated from Siemens and came here. So I think we have traveled a lot, and in Rajiv Gandhi Cancer Institute also, though is the diagnostic and therapeutic is the main concern, but now our focus is really into prevention, creating awareness. And you look at the data for the last almost 10 years now, we have done more than 150,000 screenings, awareness programs, both in the population base as well as in the supported, those are called by the institutes or schools or this. So what they call it, I think they call it, is slightly different from the normal population-based one. So, and the results are amazing. The power of prevention, everybody knows about it. We have done more like 150,000, and we find that almost 6 to 7% of those have been detected with early cancer stage. So they are given, the basic, as you know that, the basic surveillance is given to them. And if anybody is detected with the cancer in the course of, the screening program, we bring them here and they're treated free. But I think it's a very challenging job. Though we say we have saved more than 7,000 to 8,000 patients just through this simple screening method. But I think those working in the field, especially as said in the underserved areas, is very difficult. The first is to create trust with the people. They think probably, we are going there and trying to sort of market ourselves about cancer. That's not true. So the work is very challenging, and we need to, I think, find new methods to really bring more and more people into the screening program, early preventive program, so that the burden of disease is really reduced drastically. And as far as awareness is concerned, I know it's very difficult. It's not only difficult in the the uneducated, unserved area, but I think awareness is lacking even in the educated people. I still distinctly remember about I think a decade back, Ms. Govil, if you remember, I think there was a program in Bengali market, the office of the ICS, and probably I think the launch of Asha Kiran probably. So there was a lot of commotion, a lot of ladies gathered there, a lot of commotion. So after that we just inquired. So these ladies, you can well imagine the posh colony like Bengali market, ladies getting there and trying to agitate or protest against this Asha Kiran big ones, think probably the cancer is a communicable disease. That was their main argument. You can well imagine in such a posh area. So I think you can well imagine the problem in the interiors, in the villages and so I think this app which you are launching will do a great job in creating awareness and bringing more and more people awareness about the cancer disease, and this will definitely reduce the cancer burden in the country. So with these words, once again, thank you very much, and we can assure you again that we are with you. Thank you very much.
Thank you, Ms. Negi. Rajiv Gandhi Hospital has always been very, very kind and helpful to all of us, and we are always indebted to them for their support to Indian Cancer Society. Now I would take this opportunity, and I have the honor and privilege to invite the representative of Roche, Mr. Subramaniam, who have supported in ICS in creating the Rise Against Cancer mobile app. Now we are grateful to Roche for supporting us. So please welcome the representative of Roche, Mr. Subramaniam, with a great round of applause. Thank you so much. Welcome.
Thank you. Thank you for inviting Roche to be part of this momentous occasion of launch of this unique app, which is Rise Against Cancer, which will empower every single cancer patient to be aware of what are the symptoms they are going through and seek the treatment at the right time. In India, the mortality incident rate is 0.7, which means that out of every 3 patients diagnosed with cancer, only 1 manages to survive for more than 5 years, and 2 patients disappear eventually. against the Western world, where the MIR is 0.3%, which means that out of every 3 patients diagnosed with cancer, 2 end up surviving and only 1 succumbs to the disease. And if we need to be on par with this particular statistics to the West, I think creating awareness in terms of diagnosis, screening, and seeking treatment at the right time from the right institution is very, very important. And we are already becoming the capital for cancer next to the Europe and US markets, with almost 2.2 million patients at any point in time in India, with almost 1.5 million new cancer incidents every year, and close to 900 cancer-related deaths next to cardiac events. And we really truly feel privileged and honored to be associating with Indian Cancer Society in developing this app, which can potentially help many patients to seek treatment at the right time. At Roche, we believe doing now what patient needs next. That is our purpose and mission, and this is one step towards achieving that mission. So once again, thank you for giving us the opportunity in partnering with ICS in this unique journey of helping and treating cancer patients. Thank you once again.
Thank you, sir, for your encouraging words. And it's great. It's a teamwork, Rise Against Cancer. It could not have been possible with the absence of any of the partner, whether it's Roche or ICS or the technical partners and our staff, Dr. Priya Pramar, Josna ji's leadership. Everything is required. Now I would take this opportunity to invite the managing trustee of Indian Cancer Society, Ms. Usha Thorat. And Ms. Usha Thorat is the managing trustee of Indian Cancer Society. She served as the deputy governor of the Reserve Bank of India from 10th October 2005 to 6th November 2010. Prior to this, she was executive director of Reserve Bank of India. Ms. Usha Thorat is considered one of the primary figure in the central banking of India. So we are really inspired by her. I would like to tell that मंजिल पाने के लिए किसी ना किसी को आदर्श बनाते हैं. मंजिल पाने के लिए किसी ना किसी को आदर्श बनाते हैं. आप हमारे आदर्श हैं, इसीलिए तो हम आपको बुलाते हैं. So I would like you to welcome her on screen. So, madam, thank you.
Cancer is not like diabetes or cardiovascular diseases or other non-communicable lifestyle diseases. The symptoms are not very evident, and by the time cancer is detected, it is often too late. This is especially so in a country like India, where there is no mandatory screening even for the most common cancers. But unlike many other NCDs, cancer, if detected early, can be cured, and a person can live disease-free. In dealing with the challenges of cancer, the experience is that there is very poor awareness and that knowledge is indeed power. As per Globocan 2020, the number of cancer cases prevalent is around 2.7 million in India, and close to 1.3 million persons are diagnosed with cancer every year. In 2020, 800,000 people died due to cancer. The Indian Cancer Society, which started its work in 1971, works across the continuum of cancer care, spreading from awareness to screening to patient support, survival support, research, and we also publish the Indian Journal of Cancer. The Indian Cancer Society has branches in different regions, and today we are very proud to launch the mobile apps Rise Against Cancer, dedicated to empowering individuals and communities in overcoming the scourge of cancer. The Delhi branch of the Indian Cancer Society took this initiative of harnessing the power of mobile usage to provide an application, a multilingual application for providing comprehensive information and guidance to individuals impacted by cancer and their families. On behalf of the National Managing Committee of the Indian Cancer Society, we are delighted to launch this unique apps today in 5 languages: Hindi, English, Kannada, Marathi, and Bengali. More features and languages will be added in due course. I do hope that you will download this app and make full use of its features. Thank you.
I feel very fortunate that I got this opportunity to introduce these women who are the symbol of Nari Shakti. These women have worked really hard to reach this place, and they are really inspiration for all of us, you know. And now I would like, I have the privilege to introduce Dr. Anita Borges, Vice Chairperson, I don't know, of Indian Cancer Society, and is a highly regarded surgical pathologist with an impressive track record with 25 plus years of experience as a cancer pathologist in the UK, the USA, and India. She has established herself as an expert in this field. Her exceptional contribution have earned her numerous rewards and orations both within India and internationally. She will be joining us through the video. You know, these women have fought all the odds, you know. They said, ये मत कहो प्रभु से मेरी मुश्किलें बड़ी हैं, ये मुश्किलें से कह दो मेरा हौसला बड़ा है. So these women are full of हौसला. So let us have a look at the video.
February 4th, 2024 will forever remain a red letter day in the annals of the Indian Cancer Society. It is the day that the dream of the Indian Cancer Society, led by the Delhi branch, has become a reality with the launch of its Rise Against Cancer interactive mobile app in 5 languages. Indian Cancer Society has been doing sterling work in the field of cancer for over 7 decades. The launch of this app is another feather in its cap. It has been and remains a beacon of hope for thousands of underprivileged cancer patients. We believe strongly that initiatives such as the mobile app will encourage people to stay 2 steps ahead of cancer. I am unable to be physically present at the celebration in Delhi. However, I am with you in spirit to share in this joyous occasion. I congratulate all those who have worked so hard to bring the Rise Against Cancer mobile app to fruition. Thank you so much.
Thank you, ma'am. And now I would like to introduce Dr. Sudeep Gupta. He's a professor of medical oncology at Tata Memorial Hospital in Mumbai. He did his MBBS from AIIMS, New Delhi. And this speaks a lot about his caliber and his competence. So let us meet him on the video. Thank you. Sorry, I forgot to tell you, he is the director of Tata Memorial Hospital, Mumbai. So we have the honor to listen to him on the screen. Thank you. And give him a big round of applause when he comes on the screen. Thank you.
Good afternoon. I'm Dr. Sudeep Gupta, a medical oncologist and director of the Tata Memorial Center in Mumbai. I compliment the Indian Cancer Society for its initiative in creating the app Rise Against Cancer for patients to receive quality health care. The first requirement is for them to be empowered. The most enabling empowerment is provision of authentic information which will help them to navigate their journey of treatment in a well-informed manner. The information will also help them to participate actively and meaningfully in their care at all times. Although this is an era of information explosion, to sift the wheat from the chaff is not an easy task. It greatly helps that curated information is available in one location, vetted by experts. Rise Against Cancer will also provide meaningful information to the general public about various aspects of cancer prevention, risk factor modification, and early detection. As with many other resources, this app will need to be periodically updated and upgraded, which I am sure the Indian Cancer Society and its partners will do. A very important aspect of this app is its availability in multiple languages, which will help it reach a wide audience in India. Once again, I congratulate the Indian Cancer Society for bringing this app into being. I promise the full support of Tata Memorial Centre for this initiative. I strongly recommend to cancer-related healthcare professionals to encourage their patients, caregivers, and the wider public to access this app on their mobiles and other devices. My best wishes.
Hi friends, I am very excited to share with you the news of a new app which has been designed by Indian Cancer Society, Delhi. It's called Rise Against Cancer. As the name suggests, it tells you a whole lot of information through videos, through podcasts, through pictures and articles about different types of cancer in very simple language. So please download the app from Play Store and give us your feedback. Look forward to it. Thank you.
Hello. When lots of information is available on the web, people go hunting around for information to various places. To avoid that, what we have done is we have created an app where we put together as much information as possible from various sources into one place. All you need to know about the disease can be got from this app. Go to the App Store, download the app called Rise Against Cancer and look at it in various languages, in various formats, where you'll get to know whatever you need to know about cancer. Thank you.
Namaste. Today I'm in the midst of this special occasion where Indian Cancer Society has taken a leap in actually creating a platform I take the privilege and pride to introduce to the world called Rise Against Cancer in the form of a mobile app. It is actually a very needed step that the Indian Cancer Society team has taken. At a point in time, there is more misinformation than information. Today, cancer is on the rise, and in India, we see about 14 lakh cancers new each year, and we have lakhs and more of survivors. Here is one unbiased platform that has brought together patients, caregivers, doctors to talk to you about some genuine information which is evidence-based and that will help your near and dear ones. Today I believe that a right information reaching a person at the right time could save more lives than all technologies put together. When we talk about cancer, it's one single entity with multiple diseases inside it. What Indian Cancer Society team has done bringing in this app is connecting the world from prevention to palliation in such a beautiful way. It's my personal appeal to all of you. Lot of efforts has gone in bringing genuine information into this platform. And the greatest service one can do in today's era of misinformation is share a genuine information with somebody else who needs more information that can give them solace, that can give them help, that can give them courage. Use this power of knowledge to improve outcomes in cancer, to get to patients, caregivers and to the world in large for preventing cancers, treating cancers and also to give the complete holistic perspective of cancer. Thank you very much. Namaste.
So happy to know that people all over India are so enthusiastic and supportive of Rise Against Cancer mobile app. So we are very hopeful that the message will spread all over India and people will download this mobile app and will be benefited and I am very sure and hopeful that the number of cancer patients will come down and the number of survivors will rise up and mortality will be lesser than before. So with the help of this mobile app, so we will be very happy if we are able to achieve that. Now I would like to introduce Dr. Priya Parmar. Under the leadership of Madam Jyotsna Govil and Mrs. Renuka Prasad, she is the main person along with Ms. Priya Tiwari and Ms. Vishali Agarwal to develop this mobile app. Now, Dr. Priya Parmar is an experienced director of operations with a history of working in the NGOs in the field of cancer control. She is skilled in non-profit organizations, sustainable development, corporate social responsibility, corporate communication, and philanthropy. She is a homeopathy doctor also. She is multi-talented. She doesn't speak much, but her work speaks a lot. And you know, she works so dedicatedly, she just doesn't bother and then keeps walking towards her destination. नामो हशरत की नहीं मुझे परवाह, नामो शहरत की नहीं मुझे परवाह, मिले ना मिले, चाह चलने से है, मंजिल मिले ना मिले. She will keep on working. Thank you.
Those were wonderful words. First time I've heard and I'm feeling very proud of myself. A warm welcome to all of you who have managed to come on a rather wet and muggy day. I will take you through a brief presentation of the application. This will be followed by a small video on how to download the application, as well as a small audio video on Rise Against Cancer. So in a world where mobile phones are so intertwined in our lives and having become so central to sourcing knowledge and information, we saw it as an opportunity to utilize this powerful tool for a cause dear to our heart, awareness. In pursuance of our vision of being a beacon of hope against cancer and in executing our mission. I'm not going to, you all can read our vision and our mission statement. We cannot ignore the pivotal role mobile phones are playing. According to Deloitte, by 2026, India will have 1 billion smartphone users. And we envision Rise Against Cancer reaching out to a significant portion of this population. Our sponsors, I hope you all are hearing. Like all Indian Cancer Society initiatives, it is available free of cost, available on the Android platform, will be coming up on iOS in another week's time. It covers information around oral, breast, cervical, and lung cancer initially, and is in 5 languages. Coming to the design, it has been designed for everyone, a cancer patient, a survivor, caregiver, or anyone who's seeking information. I got an input that with Ms. Pandey's so-called death, there were a lot of people who were seeking information around cervical cancer. So there are information seekers there who need information around cancer, and that's what we are trying to bring about. This app provides an end-to-end guidance for busting myths, addressing stigmas, talking about the importance of screening and early detection, treatment, and more. It is available in 4 regional languages: Hindi, Marathi, Bengali, Kannada, and of course the all-pervasive English. We are going to bring in more languages at a later date. We realized when we went out on this ambitious task that it costs a lot of money when we have to translate all content into different languages. Now the content offered is diverse, simple, easy to understand, catering to people from all walks of life, with a focus on awareness, patient navigation, and knowledge sharing through videocasts, podcasts, articles, quizzes, and news feeds. This has been designed by experts, the doctors, but importance has also been given to cancer survivors as well as caregivers. So it's a healthy mix of expertise and practical experience, which we want to give it out to the public. We are just going to showcase a short video on our experts.
আমি ডক্টর অরুন্ধতী দে।
नमस्कार, मेरा नाम डॉक्टर कंचन कौर है।
This is Dr. Ullas Batra.
I am Dr. Rupinder Sekho.
Inhale, extend the hands outwards and then up.
I am Dr. Aditi, a breast cancer surgeon.
Today we'll discuss about oral cancer.
Hello viewers, my name is Dr. Divya Chaudhary.
I'm Advocate Mansi Bajaj.
Juhi Sharma and I'm a psychologist.
I am Rekha Gulabani.
नमस्कार, मी डॉक्टर प्रियंका दिगड़े।
हेलो एवरीवन, आई एम रीटा भल्ला।
मनीष, मैं जानना चाहूंगा क्या टर्म इंश्योरेंस भी एक अच्छा आइडिया है?
The Prime Minister's National Relief Fund.
Thanks for tuning in. My name is Adya.
ನಮಸ್ಕಾರ, ನನ್ನ ಹೆಸರು ಡಾಕ್ಟರ್ ಅಮೃತ್ ಕದಮ್ ಅಂತ.
डॉक्टर सौ सुषमा सुनील पवार इंडियन कॅन्सर सोसायटीच्या वतीने आपल्या सर्वांचे स्वागत करते.
Through this application, we are addressing the community need, which goes beyond treatment and after effects. We have incorporated information around diet and nutrition, resources that a cancer patient and a survivor requires, survivorship issues, mental and emotional health, exercises and physiotherapy, social issues such as legal help, the importance of health insurance, the type of financial aid that is available, government schemes which give you access to these aids, and so forth. The community need has been looked into to develop a community connect. And this community connect we are trying to build through the mobile application by way of online events, offline events, and of course, news feeds. What are the outcomes? You know, everyone will ask us, what are the outcomes that we are expecting? Outcomes, we have brought it down to 3 levels. At an individual level, we expect better decision making around your own health. For a patient, it could be adherence to treatment. For an information seeker, it could be going for their screening. For a caregiver, how can they address their emotional health and how can they look after their own loved ones? At a community level, we are looking at developing support group communities pan-India virtually. At the national level, bringing the voice of the cancer patient, the cancer survivor, and their caregiver to the ears of the policymaker so that they can address the issues of accessibility, acceptability, affordability, equity in cancer care. We do hope that this mobile application can work towards addressing the Indian challenge, and we could contribute a role in reducing the cancer burden. Coming to team, we started as a small team. This is our team which started. There is Gaurav over there, whom we floated the concept to. Gaurav, stand up. You need a stand. Gaurav was there in that team. Tarun, of course, came in much later. Gaurav and Richa believed in us when it was a concept. And in fact, there were no takers. And I think, thank you, Gaurav, for being here, because they kind of believed in what we did. And of course, though we are soft selling you all, we want more money later. So they believed in us. This is this Choti team, Choti Priya, Vaishali. There is a guy in the audience with mic on his head, Deepak, who used to go with his backpack videographing the doctors. Of course, Mr. Negi, we can't thank him enough for all the help that Rajiv Gandhi gave us by way of doctors. And of course, first of all, 3 cheers to all our volunteers. All these podcasts, the audio casts, they have all contributed selfless service for it. So, I think 3 cheers to all of us. And as Dr. Sudeep mentioned, that more languages are going to be added, more cancers are going to be added. So this is always going to be a work in progress. I mean, we can't just say that we've finished with it. It's going to continuously evolve. Gaurav knows our other dreams also. I do hope he can help us. The Roche team can also help us. Vinay, you are also sitting there. In fact, you also need your moment of fame. Please come up on stage. So it has been a happy mix, of non-commercial interests from a commercial entity, as well as philanthropic effects of a hospital which believes a lot in patient capital, rather than, just the commercial aspects of it. So I would just like to show you the team. We started as a small team, and we would like to thank everyone who has actually been the backbone. Mrs. Govil is sitting there smiling a little shyly, but she was the guiding force who prodded all of us on. And all our branches helped in ways that we can't explain. I think we all can rise together to close the care gap in cancer awareness, at least. Vaishali, will you show the small little video on how to download the app? Open to constructive suggestions, not criticism. You have our contact details. We have a WhatsApp number. We have an email ID. And of course, you can always visit us at our branch office. Or else you can meet Vandana. She's coming from the headquarters. Thank you, everyone.
In every sunrise, there's a promise of hope. Rise Against Cancer brings this promise to you. Arm yourself with knowledge, accessing a world of vital information. Find strength in a community that uplifts and inspires. Explore resources that empower, inform, and guide. Engage in events and groups for shared support and growth. Keep abreast of the latest, staying informed and empowered. Stay vigilant about cancer and spread awareness among others. By empowering yourself with knowledge, you become a catalyst for change in the fight against cancer. Download the Rise Against Cancer app today and position yourself and your community 2 steps ahead of cancer. Together, let's rise in this fight.
Can we now have the reveal of the app, please? So impressive, I'm so impressed and overwhelmed with all this, the presentation, and Dr. Priya speaks so well and from her heart, I think I have become very emotional about that thing, how Priya Parmar has described everything. Why people come late to the hospitals? Because they have got taboos. And two of them is, one, they feel that cancer means death. So when they go through this mobile app, they would come to know that cancer doesn't mean death. They can survive after death if they come at the earliest possible stage. One thing. Second is, people feel that, there is no treatment for it. It may, and they don't want to come forward. They don't want to talk about cancer. They don't want people to know that they want to know about cancer. So this app, they can download on their mobile, and in their privacy, they can read it. They need not go to anyone. They're so hesitant to talk about cancer to others. So if they have this app, in their privacy, they can read it, understand it, and this is, health literacy is very important. So here I would say our Indian Cancer Society has hit two birds with one stone. One is telling the people, change your mindset. Don't think it is death. Don't think it is not treatable. So सोच को बदलो, सितारे बदल जाते हैं. नज़र को बदलो, नज़ारे बदल जाते हैं. कश्ती बदलने की ज़रूरत नहीं, दिशा को बदलो, किनारे खुद बखुद मिल जाते हैं. No, so we have to change the mindset of the people. Secondly, this app empowering the community. Everyone should take the responsibility of their own health in their own hands without talking to too many people. So you should be empowered. Whether you succeed or not, that is secondary. But we should take the responsibility of trying our best. Gita says, Karam karo, phal Ishwar pe chhod do. What will happen, but at least we should make our effort. साहिल की तरफ कश्ती कर ले, तूफान के थपेड़े सहना क्या. साहिल की तरफ कश्ती कर ले, तूफान के थपेड़े कहना क्या. तू आप ही अपना माझी बन, मौजों के सहारे बहना क्या. Don't go with the flow of the circumstances. Fight against the circumstances as much as you can, but leave rest to the God. Now I have the privilege to invite on stage our chairperson, Mrs. Jyotsna Govil, and our guest of honor. She is on Zoom. Guest of honor, Dr. Urvashi, Madam Vandana, Mrs. Renuka Prasad, Dr. Priya Parmar, and Mr. Madhav, and one more, and Colonel Tomar on the stage. Sorry if I missed anyone. Then I ask them to inaugurate the app, and I would like to say a few lines about yes. Who will speak? Sorry. So just a minute. I would like a few lines about Jyotsna ji and Renuka ji. Okay. Thank you. Okay. Sorry.
Okay. Thank you for inviting me for this. Unfortunately, I couldn't be there in person, but it's still a pleasure to be able to join. And Jyotsna ji is somebody I've come to know through the work in this space, and someone who I respect and admire greatly. So that is why I made it a point to be present in whatever way. And I think looking at this from multiple hats, one, of course, I am a trained public health professional, but I've also been working in the policy space now for many years. And I'm also myself somebody who's dealing with stage 4 cancer. So I think, unfortunately, I'm very uniquely positioned to look at, any such initiative. And I think that it's come not a moment too soon, because unfortunately we are very, very low on awareness still about this disease. For instance, the kind of cancer I have, which is an extremely rare form of lung cancer called ALK positive, which is actually 90% of the cases it is diagnosed at stage 4, because there are no symptoms before that, there is no screening, etc., and it's not something which is inherited or genetic or even understood, why it happens. And in fact, it happens majorly in young people and women, particularly in the Asian and South Asian regions. So, cancer, as we all know, is not one disease. It's 200 different diseases. There are so many cancers that most of us would in fact even not be knowing about, even though we work in this space and we work in this field. So we certainly can't, expect the population at large to be aware of these. And so I think it's really important that we make these outreach efforts. Of course, they have to be in all languages also, and I think that's a very important effort that you're trying to make through this app, is to try and bring it in more and more languages, because, of course, India is not just about Hindi and English. And I think, just the incident that has happened, with this lady, with Poonam Pandey, I mean, personally, I was very, upset by that, because I think she made a mockery of not just the condition, but she made a mockery of people like me who are fighting, every second to defeat and beat the odds. And so she also made a mockery of death. I wish people like us could actually just drop dead in death in an instant and come back. That's not how it works. So we were extremely triggered, me, my husband as a caregiver, and we just thought it was an appalling taste. And the fact that so many people are defending it by saying that, oh well, at least she created some awareness, just shows the very low bar that we are setting for ourselves as society. If we need a Poonam Pandey to create awareness about a disease which will affect 1 in 2 of us in our lifetimes, then we have a serious problem on our hands as society. So I think whether it's doctors, whether it's health professionals, whether it's the government, of course, I work in the government, and I always try to push, this discourse, because as I said, I wear some very unique hats, with which I do my job. So whether it's the media, whether it's anybody, we have to do more to create awareness about this disease, to get the right messages to reach people, so that our bar is not set so low that, we need a cheap publicity stunt to create awareness about something which is so serious and is daily affecting so many people's lives. And, as my husband wrote on social media, and he rarely does, but he was so outraged by this, that, this is not a disease which affects just an individual. It can destroy entire families, as it's destroyed my very own. So I think there's a lot that we have to do, and so I really congratulate you on this effort. I will certainly do my bit to try and make sure that people know about this app, and they reach out to this for credible information, and I hope and I wish it all the success. So thank you very much for having me here again. Thank you.
I would request ma'am to stay for a little more time. So most of you know him, Madam Urvashi, but those who don't know, I would like them to know that she is director of Niti Aayog. She is among the many distinguished groups in various fields. In the field of business world, she is among the 25 most influential women in healthcare. Amongst the 100 most influential women of 2023, she is also there. She is among all those 40 women who were under 40 and who were considered great under healthcare. She is the recipient of India UK Achievers Honor. She is healthcare change maker and awareness speaker She is healthcare change maker awardee. So many awards, so many laurels to her, so many feathers to her hat. So I would just like to say, आसमां से ऊंचा कोई नहीं, चांद सा शीतल कोई नहीं, महफिल में स्वागत है आपका, क्योंकि आपके समान इतना भी प्रेरणादायक और कोई नहीं. Thank you. Now, I would invite the people to inaugurate the RAC, Mrs. Jyotsna Govil, Madam Urvashi, Madam Renuka Prasad, Dr. Priya Parmar, and Mr. Madhav and Colonel Tomar on the stage, and Dr. Diwan also, and Dr. Negi. And for Jyotsna ji and Renuka ji, I would say they would work very hard. जब आंखों में अरमान लिया, मंजिल को अपना मान लिया, फिर मुश्किल क्या आसान क्या, ठान लिया तो ठान लिया. Once they decide, they would work towards that. Thank you so much.
This is one time when you open your phone. Please come to this side. Please open your phones. Please check this side. Pinky, आजा.
We can take this. This. Thank you.
Okay, you're allowed to give us a round of applause. Thank you.
Moment of celebration. Make some noise, clapping, please. Yeah, it's a moment of celebration. So now, let us invite Patrodish, the marketing agency which supports Rise Against Cancer mobile app, for the press release. If you have any questions, please ask the questions to our team. Thank you. So I would invite Mrs. Renuka Prasad, our honorary secretary, to say the word of the vote of thanks. Thank you so much. She is our guiding force, Mrs. Renuka Prasad.
Well, I'm back here, but this time I'm wearing my glasses because I don't want to miss out anyone here in the vote of thanks. Of course, basically my heartfelt gratitude to Mrs. Urvashi Prasad for taking time out of a busy schedule, even though she came by Zoom, but at least she was there to speak with us in person. And we from the Delhi branch are extremely thankful to Chairman Mr. Hari Mundra and the Honorary Secretary and Managing Trustee Mrs. Usha Thorat, who gave us immense support, reposing their faith with us during the development of the app at every stage, and providing necessary funds for that also. They have also played a major role in getting us the Marathi videos of the doctors, podcasts and Survivor Speaks. One has to thank you also for that. And I also thank Madhav Neni, the marketing head, who has been with us since yesterday, spearheading the marketing team to put it all in place. As you saw, everything went without a glitch. We thought we wouldn't have Zoom, but we did have Zoom eventually. So thanks, Madhav, for all that. We are very grateful to the CEO, Mr. Negi, of the Rajiv Gandhi Cancer Institute and the Research Center, and his team of doctors for hand-holding and for co-hosting the event for the launch of the mobile app. With them, in fact, we share a great bond and have always looked at them for helping out when required. Just as they are with us, so are we for them at all times. Roche for believing in our concept, and as co-sponsors for the technical support provided through Kidlets, who provided the structure for this app. Above all, the team of our dedicated staff. It's a very small team that we've got, but it's a very dynamic team. It's led by Priya Parmar, whom you've just met as our COO, and she has these young girls under her care, Priya Tiwari, whom we call Choti Priya, otherwise we confuse the Choti Priya with the Badi Priya, and Vishali, and our staff volunteers who have helped for us for the realization of this dream. They've all come in with their videos, they've all come with the podcasts,
there has been no hesitation at all whenever Priya has asked anyone to come in. And this also goes for all the Rajiv Gandhi doctors who have provided us the basic material which is uploaded here. And I hope you're all going to enjoy watching what you have said and continue to support us in the next stage that we get on to. So, of course, Petri Dish, our media and our PR partners, the press gathered here this morning, unfortunately, there's nobody, but all the same, we need to acknowledge that they have been coming to the office and taking interviews. Plus, they have been calling up Jyotsna to get one-to-one interviews, which has been going on since the last 3-4 days. So thank you so much for that. And how can we forget you all, our esteemed guests, even though there's just a handful of you, who are with us today, both physically and virtually. Thank you, everyone.